Thank you. So our next person on the list is Tadesse.
My question is, do you think that poor people without health care should pay like a small amount or not have to pay at all for health care?
So you were kind of breaking up, but your question is, can people pay a smaller amount for healthcare?
Yes.
Okay.
Thank you for that question. So I'm going to speak as Kim Jackson, age 37, from on Ruby Road in Stone Mountain, Georgia, just as Kim. And as also, I am a pastor and a person who really does try to follow the teachings of Jesus. I fundamentally believe that all human beings should have access to healthcare, regardless of their ability to pay. That's what I believe. I believe that in my heart. Now, how our government and gets to that place, how we're able to fund that and pay for that, I don't really know, but I do 100% believe, I follow the teachings of a man who walked around, hundreds of years ago, and he gave out free healthcare to everybody. Like if you walked up and you're like, hey, I'm lame, I can't walk, Jesus was like, all right, cool, I got you. And he didn't ask for any money. He didn't ask for any papers. He didn't ask for citizenship, right? So those are the teachings that impact my life that I try to live by. And so that's what I would hope for all citizens. Again, I can't answer how we get there. I just know that that's what I would hope for.
And I can add one thing to that. I think most of us share the same belief that everybody needs access to healthcare. One of the challenges in Georgia that we have that's not just unique to Georgia, but especially in our more rural parts of our state, is even if you have access to healthcare coverage in some way, you still may not have a doctor that you can get to that's close by. And you may not have a special kind of doctor for whatever you need that you're sick with to get to, even if you have a general doctor to go to. And so it's also, as we look for ways to fund more access to care, we have to also look at not just getting people coverage, but making sure we have incentives for doctors and specialists to go in certain parts of our state and work. And that's one of the things that both sides at the state capitol has worked on in the budget this year. We're adding more residency programs to try to, in our medical schools, to try to send people to more rural parts of our state and have more doctors in our state. And so I'd agree with my colleague. It's something we strive for, but it has many levels we have to look at on that.